I was just wondering if you could go over the symptoms again, like things that people should look out for. And then also people that got it in the last 6 to 13 days, should they go to the doctor to get checked out?
Thank you for those questions. So it's important to understand that this entity that has occurred is extremely rare. The vast majority of individuals who receive the Johnson & Johnson vaccine have done well. There's only 6 of these cases that have thus been identified out of 6.85 million doses given, and we've only given 31,000 here in Rhode Island thus far. With that said, we would not want to have everyone who's had Johnson & Johnson just rushing to their provider to be evaluated because of how rare this seems to be. However, we do want to ensure that both patients and providers are informed and equipped with the information of what to monitor for. So the presentation that has been identified among the 6 individuals thus far are that all of them have been female, all of them have been within the ages of 18 to 48, and all of them had symptoms that occurred 6 to 13 days out from after they received the vaccine. The symptoms that are part of the presentation are very severe headache, abdominal pain, leg pain, or shortness of breath. The other elements of the presentation are clots that end up being identified, as well as low platelets. So hopefully that package helps reassure people on how to handle it, and we are checking to make sure that providers have what they need.
Doctor, is there any connection between this and a person who may be on birth control? And is that something that could help narrow the pool of people who should seek medical opinions, I guess, not really treatment, but opinions about whether they should be more prone to monitor right now?
There is information that they're still learning. The association with birth control is not very clear at this point. The understanding is that this clotting is somewhat different from what could be associated in that scenario. But this is the value of the pause. It allows for them to really be able to understand what was identified as a cause for those 6 individuals, and what information can be provided to members of the public in terms of added precautions.
And if I could just quickly follow that up, I mean, this is fuel for fire to the people who are out there that are saying, oh, well, you shouldn't get a vaccine because it's untested, it's experimental, people shouldn't be required to have it to go back to school. I mean, this will just fuel that fire. How are you planning from a messaging strategy to get the numbers out there other than this press conference, the realities of this being 6 in X million people?
Yeah, well, the partnership with you all as the media and relaying those messages accurately and in a timely way is key. We are certainly prioritizing engaging with our providers who are, the primary resource, appropriately so, for so many individuals, so that providers have that information and can equip their patients with the understanding that this is 6 cases out of 6 million individuals who have received the dose of Johnson & Johnson and have done well. And Johnson & Johnson will continue to be a very helpful option for individuals, the vast majority of whom have tolerated it without any problem. So a key here is understanding nationally and at the state level that we have a working monitoring system. It allows us to pay very close attention. We haven't gone hundreds and hundreds of cases into this before it's identified. There's only been 6 cases identified. Allows us to pause, make sure that providers are informed on what to do differently and what to look for, and to be able to study even further before any additional doses are administered at the federal or state level. And then we can resume when and if that's determined as appropriate, with the proper information in hand on how to continue to keep people safe and protected.
Dr. Scott, can you give perspective to people out there listening who are curious as to why 6 cases of this would cause the entire pause altogether? I'd be surprised if there weren't some kind of 6 negative reactions to all the vaccines. I mean, are there not any on the other vaccines, and what makes these negative reactions different to stop the whole country from getting it?
Yeah, it's an excellent question. Dr. Fauci answered it very well on one of the earlier calls today. One of the elements that is different about the thrombosis that has been identified in these 6 cases is clinically, we would usually treat thrombosis with the medication referred to as heparin. And being able to pause with just the 6 that we have could get the message out to all providers that this presentation is leading to not using heparin as a treatment option. So being able to get that message to providers has been a critical element of this and warranted the pause so that we could make that clear, because that is a definitive shift from how we would usually treat such a condition identified. The other element was being able to ensure, with access to the millions of doses that have been administered, that it truly is just the 6 that have been identified thus far. And so pausing allows also for that attention to be paid to, are we seeing anything else? Is there anything else we need to learn? Are there any other adjustments that have been made? So people can really be confident that the system for monitoring for the safety of vaccines has worked well in this situation. And there have the vast majority of vaccines that have been administered are Moderna and Pfizer vaccines. Millions more have received that. And this shows you that there has not been any signal in those in terms of safety. Seeing how refined the signal can be before it's able to get the system to kick in, to place a pause and allow us to respond differently. So I'm hopeful that with your support, we can really help get the message out to Rhode Islanders about how ultimately reassuring this whole process is and how confident they can continue to be in our vaccines.
How prevalent has any sort of adverse reaction to either Pfizer or Moderna been in Rhode Island in terms of numbers? Do you know?
Extremely low. We have a robust, we are participants of the robust process nationally with our vaccine adverse events response. And we have had minimal allergic reaction symptoms that have occurred and nothing that has risen to the level of severity along the lines of what's being reported today nationally. And we will continue to participate in that. Again, only 31,000 doses have been administered, so we are very far off from that 1 in a million risk.
Doctor, the Janssen vaccine, of course, is the only single-dose vaccine. And as a result, it's been an important factor in vaccine equity because it's easier to reach people for whom getting them to the second dose might be challenging. And that would include not only people in lower socioeconomic strata, people in hard-hit communities, but also prisoners, homebound individuals, the homeless, and so on. What do you see, assuming this pause isn't very short? I mean, I heard Dr. Antruchet of CDC saying that she expects the pause only lasts a few days. But if the pause continues for any significant amount of time and cuts into the supply of single-dose vaccine that is available, what do you think, or what do you see as the effect on those particular communities for whom equity is a concern? And what do you see as the messaging the state needs to undertake, because the Janssen vaccine has something of an undeserved reputation for being sort of the second-class vaccine?
As you noted, we anticipate and certainly look forward to this pause being brief so that it has a minimal impact on how valuable Johnson & Johnson is for being able to provide some of the protection in across the board, you know, to individuals that have had very allergic reactions to vaccines in the past and just want one, or those who are homebound or hospitalized or otherwise. So we are anticipating that in the long term, we'll be able to continue with the appropriate safety mechanisms in place. But if that were to not be the case, we would be prepared to adjust as we needed to and as we were planning to prior to Johnson & Johnson being available, working with our partners and determining ways that would allow that would help ensure that people are able to return to get their second dose. And as you all can see, the Rhode Island state team is on their game and are able to do what's needed with getting the vaccine out to Rhode Islanders in the best way possible. So whether it's Johnson & Johnson, Moderna, or Pfizer, we will make it work.
How do you see this, Dr. Oh, sorry.
I was going to ask you, do you see any, and just to follow up on that, do you see any consequences to the very limited population of people who are advised not to get the mRNA vaccines because of anaphylaxis risk with lipid nanoparticles, because the Johnson & Johnson vaccine was their only option?
Yeah, that's something that we're going to need to work on together with the federal officials, because we wouldn't be the only state that has to handle that. And we'll be ready to assess and make the adjustment that we need to.
You had mentioned that.
You could...
Go ahead, Gina.
Sorry. You had mentioned that there was about 300 people that would be affected by the dosages. Would they be contacted, or is there more than that who are going to be affected by their appointments, and when would they have to reschedule?
Yeah, so right now there's 2 different allocations coming into the state each week. There's what we get at the state and then redistribute to our partners. So of that, about 300 Rhode Islanders are going to have their appointments rescheduled. And it was, you know, with those 3 specific partners that I mentioned earlier there. So that is Green Line Pharmacy, White Cross Pharmacy, and Rhode Island Free Clinic. They will be calling everyone that's impacted. For the vast majority of people, if you had an appointment at a mass vaccination site, an HDC clinic, a regional municipal site, your date, your time, your location remains the same. We're just going to provide a Pfizer or a Moderna vaccine. So the other allocation that comes in is there's a separate federal allocation that goes to some of our retail pharmacy partners. So we're working with them directly. And the expectation is that every Rhode Islander that's impacted will be contacted, try and limit the disruption as much as possible. But Rhode Islanders that made appointments at CVS, Walgreens, Walmart, and Stop & Shop will be contacted directly by those pharmacies.
This is Amanda Hoskins with NBC 10. Sorry, I've been having some audio issues, but can you just kind of speak to the timeline in general? A lot of people have been kind of watching it and seeing, especially because of the Johnson & Johnson 1 dose, how it really helps ramp things up. How do you anticipate this will impact things? Obviously, Rhode Island has not received too much Johnson & Johnson at this point, but I'm sure it has been included in projections.
Yeah, so as far as some of our future planning here, the Johnson & Johnson vaccine allocations have decreased pretty significantly over the last few weeks as they continue to build out the manufacturing infrastructure. So we've relied heavily on the Pfizer and Moderna allocations that we know are coming into the state. So based on what we know right now, I think the milestones that we shared last week, the May 15th, for the opportunity to get 70% of Rhode Islanders that are 16 plus vaccinated, and June 5th, 70% of all Rhode Islanders, about 750,000, their first dose of vaccine, that's still intact. If this pause is prolonged, we'll reassess, because we were planning on having the Johnson & Johnson manufacturing ramp up, into May, and we should be receiving about 16,000 doses a week then. But right now, I would say no immediate impact to our timeline, but something that we're watching closely, and we'll adjust as needed. The good news is we have a very robust distribution system in place. So when the pause is lifted, just about any amount of Johnson & Johnson that we have in the state, we could administer that week.
Just to go off of that, do you have any indication on how many doses of both the Moderna and Pfizer vaccine will be allocated to the state? Do you have any hard numbers for the next few weeks?
I do. It's going to remain consistent. They have ramped up the manufacturing for Pfizer and Moderna pretty significantly. So what that means for the state of Rhode Island is that for the state allocations, we'll get about 52 to 55,000 doses a week. For the federal allocations direct to some clinics and some pharmacies, that's another 12 to 15,000 doses. So somewhere in the neighborhood of about 70,000 doses a week. So for context, the last 2 weeks, we've been administering 86,000 doses a week. So there is an impact, but we think we're well positioned to be able to rapidly shift as we learn more.
And because this vaccine was easier to distribute and store from an operational standpoint, could you just kind of tell me, is this going to be more difficult to reach those who are homebound or place in mobile clinics in high density communities with the Pfizer and Moderna vaccine, where you have to convince people to come back for the second dose?
Yeah, we'll have to adjust our approach. And what I think, the team has done a really fantastic job of is testing out different methods and learning as we've progressed. So what was important very early on when we first introduced the Johnson & Johnson vaccine was ensuring that, Rhode Islanders had a choice. So at that point, we were figuring out how you vaccinated homebound Rhode Islanders with either Pfizer and Moderna or the Johnson & Johnson. There are some, pretty significant operational benefits to the Johnson & Johnson vaccine. That's why I think it remains, an important part of the overall approach to fighting COVID here. So looking forward to getting some more details from the federal government on how we can safely and effectively begin implementing again. But I think we have contingencies in place, so we'll be able to adjust without skipping a beat.
Do you think this will affect people's hesitancy? Do you think that it will prevent people from wanting to get vaccinated and make them a little bit nervous about that, since this, it's only 6 cases, but with this investigation, more could come out of it? What would you have to say to that?
Yeah, I think in order to meet our goals of vaccinating all Rhode Islanders, we're going to have to be intentional and deliberate in our engagement. And part of that is increasing confidence. Part of that is increasing access, reducing barriers. So it has always been a part of the plan to have that ongoing continuous engagement, to continue to not just gain that buy-in, but also that sense of urgency to get vaccinated as soon as you're eligible, as soon as that there's an appointment that's available. So I think the biggest thing here is just ensuring that we can get the facts out there as quickly and transparently as we can. I think Dr. Alexander Scott and Dr. Fauci earlier did a really fantastic job of putting this all in perspective. 1 in a million opportunity for an adverse reaction. And what we should take away is that our monitoring systems work, and they're really, really good. So when we scale that, to Rhode Island, we're nowhere near approaching that 1 million dose threshold. So I think the risk remains extremely low. It just continues to be, how can we do even better? So hopefully after a few days or a short period here when the pause is lifted, we can continue, that engagement, not just specific to the Johnson & Johnson vaccine, but in getting vaccinated, more broadly.
Hi, this question is for Dr. Nicole Alexander Scott. This is Alexandra of Channel 12. I'm wondering if you might be able to speak to the risk of blood clots for those who have COVID-19, just to kind of give some people perspective on the risk kind of at either end of the vaccine or not having the vaccine.
Well, thank you for that. The comorbidities of COVID-19 in and of itself, including blood clots, is something that is continuing to be evaluated. It also is relatively rare in how it occurs as a long-term or a complication of COVID-19, and is something that presents in a way that's somewhat different from what's being described here. Key elements to call out with these 6 cases are specific to the females, the age of 18 to 48, the time frame of 6 to 13 days specifically after a vaccine, and the association of very low platelets with clotting occurring in the 6 individuals out of the 6.85 million. So they are similar in terms of talking about a thrombotic event, thrombosis, but happen in very different contexts when you look at thrombotic event after COVID-19, which is rare, versus the extremely rare presentation that we're talking about today.
I had a quick question about storage. Are you guys expecting there to be any doses that have to be wasted or thrown away as a result of the pause?
No, none at all. The team has done a fantastic job. Our waste is well below even 0.1% at this point. And based on the additional flexibility we have, especially with the Johnson & Johnson vaccine, we're not concerned about that right now.
For Tom McCarthy, what effect do you see of hesitancy increasing potentially as a result of this? Not necessarily that it's rational or well-founded, but if it's irrational and not well-founded, do you see that interfering with the stated goal from last week of reaching 70% of everybody eligible to be vaccinated by May 15th and 70% of the entire population by June 5th, especially because I did the calculation. In order to reach 70% of the entire population of the state, we have to reach about 85% vaccine take-up in those eligible to be vaccinated. And I think that arguably was a challenge to begin with because of hesitancy.
Yeah, absolutely. And that's something that's top of mind for me. It's ambitious, but it's absolutely achievable. And I think, why I am confident in it is that among, those groups of Rhode Islanders that are currently eligible, we have seen uptake rates, around that mid 80th percentile. So I think it's absolutely doable and achievable. But the important thing is we all have a part to play, whether it be getting vaccinated, having conversations with your loved ones, your neighbors, folks in the community, to make sure, that people are educated, they have the facts. I find that there's a tremendous amount, and it's something we've seen throughout the pandemic, just based on how dynamic it is and how quickly things change. There is a lot of information out there. Making sure we get the right information, the facts to build, that confidence is going to be important. So again, before even this consideration, we knew that it was going to have to take a deliberate, intentional community effort to achieve those goals. So I don't think that has changed. I do think, though, this gives us an opportunity to focus some of our conversations even more about, some of the specific safety and impacts of the different vaccines.
Is there a last question?
Tom McCarthy, some clinics who received the J&J vaccines don't have the ability to store Pfizer or Moderna, some of the smaller clinics in particularly. What happens to those clinics that have already signed people up for the Johnson & Johnson? Are they going to be allowed to, be directed to other spots? Might there be a delay? Can you talk, and do you have any idea how many those are that are at clinics that only can accept Johnson & Johnson?
Yeah, so our current estimate, and this is evolving throughout the day, is about 300 of those Rhode Islanders that were scheduled against that state allocation, and that was those 3 specific locations. So in those instances, we are going to find a way to make sure that they are taken care of, whether it be rescheduling at a different date and time at that provider, or bringing them into one of the mass vaccination sites. We're going to find a way to make sure that they get their vaccine.